Welcome to the One Day at a Time Recovery Podcast, where my guests share their stories of addiction, how they recovered, and the tools and practices they use to stay sober now. Well, Dr. Koo, thank you so much for joining me today.
You're very welcome, Marlene. Excited to be here.
Thanks. Listen, we were just talking before I hit record about how psychedelic-assisted therapies are really interesting for people who are in recovery. And I realized we'll talk a little bit about some of the controversy. If you're sort of 12-step oriented, that's very much the old school thinking is we don't take anything no matter what. Don't take nothing no matter what is kind of what the old crotchety timers will say. But it was kind of funny because Prozac has been out for about 30 years, let's
Since
say, right?
1980s, yeah. Yeah,
Yeah.
48.
So when it came out, people in 12-step rooms were very anti. I think we've had a lot of education since then. There's this awareness that a lot of this brain chemistry can be modulated, or it's sort of like a little hammock for people who dip too low, and a lot of people with addiction have. Is the term coexisting?
Comorbid or coexisting
Yeah,
condition.
yeah, I hate to say morbid, but
I know.
yeah,
Such it's a bad term.
it sounds very
Well,
negative.
dual diagnoses. Well, even the whole
Yeah.
concept of separating out substance use disorders, and mental health, I think it was really a mistake way back. I think there was a
Mhm.
lot of judgment and stigma, right, about the idea
Yeah.
of addiction being
Yeah.
much more of a choice. And we
Yeah.
obviously know it is not a choice, and there's tons of genetic factors, and every mental health condition, right, involves
Yeah.
genetics and life experiences and support systems and personalities, right? But it's interesting, I do find that there's been a lot of improvement in terms of within the AA space. Um, less stigma against antidepressants or mind altering
Yeah.
substances. But it's still challenging, right? And I think that I think it's just always a debate. I tell people you really need to know what's going to work for you. I find that most people that struggle with addiction, often do have a coexisting depression or anxiety disorder. They have trauma, and not that it necessarily means they need a medication, but they certainly need therapy or insight to be able to maintain a life of recovery, right? If they're not treating an underlying, right, cause or trigger. Um, I also think it's interesting what you said, because for me, I'm not sober. I'm not in that addictive space. Obviously, part of my company, we deal very much on the higher levels of care as well as long-term recovery, and we are pretty abstinent model. We're 12-step based. Obviously, psychiatric medications when indicated. But I always laugh at the guys because they'll come in and they're smoking like chains, chain smokers. I'm like, okay, all right,
Yeah.
no mind altering substances, but that
Where's
nicotine
the
is
line?
really going in there. So
Yeah, that's really funny because I'm sort of I wouldn't say I'm anti-cannabis, but I personally am anti-cannabis because I that was my drug of choice. Alcohol and cannabis were my drug of choice. And you talk to those people that are so defensive about wanting to hang on to their cannabis, and then they always throw out the cigarettes and the sugar.
right.
Right. Oh, at AA meetings, there's coffee, cigarettes, and sugar. And that's sort of their argument. But I'm like, yeah, but I have never heard of anybody getting arrested for impairment while behind the wheel because of nicotine, caffeine, or sugar. So there is a distinction, but it's all so nuanced now. And it is all so confusing about what is abstinence, what is not abstinence, when are medications okay, when are they not okay. And I think ultimately, and I'd be curious to hear what your opinion um, is that it comes down to, like, it's good to wrestle with the questions. Is this about escapism? What feelings am I trying to avoid?
Yes.
Right? Or what feelings do I actually need help with?
I totally agree with you. I don't think it's wise to judge anything as good or bad.
Right.
I think it's important to be educated, right? Because as you
Oh my
say,
gosh.
substances, just by the nature of their chemical structure, have the capacity to develop tolerance and
Mhm.
addiction, and some don't, right? But I always give that example too. I mean, glue is not an addictive substance, and people, abuse snorting glue, right? And
Oh, they sniff the
so
fumes,
yeah. And
puffing.
so and then there's alcohol and cannabis, right? And then there's prescription medication, right? The
Right, right.
benzodiazepines and the stimulants. And so to me, it's exactly what you said. It's you need to know yourself, you need to know your genetics, the risk factors, you need to know why you're doing something. But whether you're talking about chocolate cake, it's okay to have a piece of chocolate cake. If you're gonna eat chocolate cake all day long, right? It's a problem.
That might be a problem.
Or I give the behavioral examples, right? I mean, people sometimes don't separate out, I think, the idea of a coping mechanism and a symptom.
Oh,
From
ooh, that's good. Tell me more about a coping mechanism and a symptom.
Yeah. So from a psychoanalytic perspective, right, we call them all sort of compromise formations, meaning it's a compromise between an impulse and a desire, a need, and a way to manage it or cope, right? And so
Mhm.
if you take the example of what you said, if someone is having a glass of wine because they're out having a nice steak maybe with friends and that's the purpose and the meaning, great. If they're coming home after work and having a glass of wine to escape feelings, right, or to deal with stressors, then that's a problem. Or running, this example, right? Running, we all consider running a pretty healthy coping mechanism. If you're running, if you run a couple miles every day and that's your routine, great. If you're running 20 miles a day for weight maintenance, right, something that we would consider a coping skill, right, is
Mhm.
now a symptom. So
Mhm.
it's
Mhm.
really context and meaning is
Contacting, yeah, and the outcome. I would imagine running 20 miles a day for like you're going to have some pretty severe outcomes if in those extreme behaviors. And it's so interesting because us as addicts, those of us who have struggled with addiction, we have really extreme like thinking and extreme behaviors, and it seems like there's always like some sort of root cause, whether it's like dysfunctional family and childhood, trauma. And it's not necessarily, I've learned that it's not necessarily trauma that happens in childhood. I've worked with adults who had trauma in adulthood that triggers an addiction after that. I know someone who went through she's a surgeon and had like residency was super traumatic. Like they beat the humanity out of you.
yeah.
And,
So
it leads to like if you dissociate from your needs so to the extreme, then how is it that once like the intensity period is over, how do you then regulate your nervous system? I think you need to be able to recognize that you have a need
yes.
and to be able to feel like your need is valid and take care of yourself, like self-care. So it doesn't necessarily like the root cause doesn't always necessarily happen in childhood. It can happen in adulthood too. And then,
Absolutely agree. And once again, maybe it's about how someone copes with those extreme stressors. And yeah, I think I had a great mentor and when I was an intern and resident and what she said is like anybody who doesn't get depressed, right, during their residency, there's something wrong with them, which is to your point, right? And it
yeah.
depends on then that combination. Some people might get depressed, some people might become addicts, right? It's how maybe your genetic propensities and as well as your coping mechanisms. But it's hard. Or the military, right? We look at all the
Oh yeah. Oh gosh.
right, the trauma, like that's adult, right? Trauma or depression, anxiety, right? Addiction in the military. And I think it's the same thing. Some of these people are taught, to behave at such an intense level and under a lot of extreme stress and sleep deprivation. It's not surprising that they struggle with their mental health.
Yeah, I know our veterans are really struggling. I know the suicide rates are really high for vets who come back from war and things. There's a really high suicide rate for those. I have a lot of compassion for those people who, yeah. So that's trauma and in adulthood, right? And so it's so interesting. I just have to ask you. So you went through residency, and maybe it was you had a little bit of depression or you struggled. How did you come out of that? Like, what was it about you that you were able to then come out of a situation like that without like falling to an
Prozac
unhealthy
and
place?
psychoanalysis.
Oh, a lot of therapy.
Honestly, yes. I
Yes.
actually started Prozac during my internship year. But for me, my big healing, which I think to me, I credit even my training. I love my
Mm,
medical school training. I love my psychiatry residence. I love my addiction medicine training. But if I named
mm,
one thing that to me has been the most valuable in my life, it was my psychoanalytic training. So through the Psychoanalytic Institute, and when you do that, you also, well, I was in it before, but a requirement is to go through your own psychoanalysis. But I had already started and almost completed my psychoanalysis before. And it's just such a depth therapy. And over a period of time, and to me it was invaluable. It's not for everybody. There's
isn't it though? I,
Well, could everybody benefit? That's a different question. I think
yeah,
everybody could benefit, right? I
yeah,
keep
yeah,
telling
yeah.
people if I had my goals, I don't know why in school starting in first grade we don't have just how they have health that goes throughout, right? Why don't they just have mental wellness and goes from first grade all the way up to 12th grade and covers everything, right? Like communication
Yeah,
skills, needs, like you're saying, identifying emotions, how to talk about feelings, right?
yeah.
I think the world would be a better place.
Yeah, we're supposed to learn these things at home, but those of us who grew up in maybe slightly dysfunctional homes, that's not taught at home. And sometimes people learn those by accident, because what you don't learn at home, the world tends to so rudely uh, correct you on.
Yes.
But no, that's real. Okay, that's really helpful to know that that everybody needs a little, could benefit from a little bit of. There's that saying that you can't read the label from inside the jar, right? We're all in our own little jar, and it's so helpful to have an outsider's perspective to help us sort of um, just see ourselves differently. It's hard to see your own shortcomings. Tell me a little bit about, I'm so curious. We had talked earlier about your involvement with MAPS. Tell me again what MAPS stands for.
Sure. So that's the multidisciplinary. Actually, I don't even know the whole names of the term. It's
I
not
think
called that anymore. It's called
yeah,
Lycos. Yes. But you can correct me on
Lycos.
apps. They've
Yeah.
changed to Lycos. And yeah, I was very lucky to apply for and have the opportunity to be a rater for their studies. And so, they did amazing, studies for MDMA with PTSD and a lot in the military.
Yeah.
And because it was a research trial, they wanted a lot of really good oversight into the process. And so, you had training, and then what you would do is watch the videos of the treatments and rate them to make sure that they followed the guidelines and did the things they were supposed to do, and everything was done accurately. And it was just a great learning opportunity because I got to like be witness of so many journeys and also see the incredible benefits for trauma that the MDMA achieved. And to me, it was sad that I think most of us in the community thought that the FDA was going to approve MDMA for PTSD, and I think we're really surprised when that didn't happen.
Yeah, so that's a relatively recent development, isn't it? So
Yeah,
MDMA was going through clinical trials,
yes,
and
complete
then the
phase three
FDA,
trials, really good results. Um, and then the FDA, yes, decided not to approve it.
wow, what do you know what their reasoning was?
Yeah, I think if I recall correctly, the reasoning for them was that, they also had a really, really good response rate for people that got the placebo, right? That didn't get the MDMA. And so there was some question about how the study was set up and the contributions, to the therapy component. Sadly, however, from my understanding, I think I don't know, I'm just gonna say what I had heard, so I'm not sure that's accurate. MAPS had worked closely with the FDA to design the study. So I think some of the frustration was when they criticized the study design, that was something that they had gone through and approved throughout.
Oh,
So
wow, that's really interesting.
Yeah.
What a bummer.
There were no safety concerns, nobody had any there were no significant bad outburst events. It was,
Right.
yeah.
Yeah. So, but so MDMA is not approved, FDA approved for trauma. Is it approved for
For
anything?
anything.
Not approved for anything. And so, but the FDA has approved ketamine. Is that true?
Yeah, so FDA ketamine's been FDA approved for a very long time. It was FDA
Okay.
approved like in the 1960s,
Right.
and its FDA indication though is for anesthesia and pain.
Oh, right.
Right. So it
Yeah.
happens a lot in psychiatry. We can have an FDA approved substance and then use it for a non-FDA cleared indication.
Right.
The issue is usually, insurance coverage, and that's the difference. And so, yeah, IV ketamine is an FDA cleared procedure. It's not FDA cleared for PTSD or depression or anxiety, but it's considered, legally, it's fine for doctors to do IV ketamine and ketamine lozenges because of the FDA approval of the substance. There's
Yeah.
also Spravato now, which is the nasal esketamine, and that is FDA cleared for treatment-resistant depression and
Okay.
depression with suicidality, and
Yeah.
that's a nasal formulation of ketamine. In terms of the actual psychedelics, so ketamine we consider more of a dissociative agent. In terms of the actual psychedelics, there are some states, right, that have it's not FDA cleared, but they've decriminalized it. And so I think there are some states like Colorado, Oregon that have a little bit more availability. Uh,
They're doing psilocybin.
yeah, but credentialed licensed practitioners in general, I think are we can't do it because it's just of our license, right? If somebody is
Um,
a true shaman, which is I think a wonderful experience, or
yeah.
they're a coach, right, or a guide, and they don't have license, then I think there's a little bit more flexibility. But as a
Yeah.
licensed provider, we have our licensure and we have
Right. Yeah. There's
practice. And so yeah,
problematic for a
right.
variety of reasons. Well, this sort of brings me back to sort of where we started with, like, if you are somebody with addiction issues, how can you determine whether something like psilocybin or ketamine is really something that could be good for you? And I think the biggest hurdle, to be honest, especially for people that are already sober and sort of in a 12-step environment, is really like the pressure and the sort of I don't want to say brainwashing because that sounds bad. I just a quick side story. When I first got sober, I was going to a lot of meetings. I was dating this guy, and I quickly realized he had a drinking problem, and I felt like the need to break up with him. And he was like, "I think those people at those meetings are brainwashing you." And I was like, "Yeah, that's exactly what's happening. My brain needs washing." Like, anyway, that was a little side note. Um, but there is a lot of ideology in the community that is against taking anything, or at least super cautious, which I appreciate. But I really have seen such huge and positive, transformational, positive outcomes on the other side of psychedelic experiences. So, how does one go about deciding whether they're, because we can fool ourselves easily, like we can rationalize and justify just about anything. So, how do we come to the conclusion that it's okay to do despite what the community is saying? And do you know where I'm going with this? It's like,
I know
how do we
exactly
decide
where you're
whether,
going.
yeah,
It's a fabulous question. I think it's a very complex answer. I think the
yeah, it is
broadest
complex.
answer, yeah, the broadest answer is, each individual really needs to know themselves very well, is what I would say. So back to what you were saying in the beginning, like really understanding what's the purpose of doing that. And some ways
Why?
I
Yeah,
tell people, like, ask, like, if you, let's say you're in a 12-step program, obviously you have your sponsor, you have your meetings, you have
right.
people that you really, that you've probably been embedded in the community and are sober with you for years, that
Yeah.
that I think if you're not telling them that you're planning on doing this, that says something right there, right? And not that you would announce it at a meeting, maybe,
Oh no, don't,
but
yeah. Side note,
yeah.
don't ever talk about this at the podium level or share
No, but I
openly. Yeah.
think I think, if it would be something to explore with your sponsor, like the why now. I also would say I mean, once again, everyone's different. There's people that I know personally that became sober doing like an ayahuasca or whatever. The people
Yeah.
that I see more often have, become sober in very traditional ways, right? Behavioral, psychosocial, all the elements. And so then I think it's more, I would say, I mean, I would be probably anxious to tell anybody to do that before at least 3 to 5 years sober, right? I mean, I think
Okay.
the idea is how grounded you are in your system, how confident you feel in your behaviors, your support system, your
Right.
life being on track.
Yeah.
Now, people disagree with me. I mean, there's a lot of people that actually use ketamine and like say ayahuasca, psilocybin, when they're actively caught up in addiction, and I have heard those stories too. It's transformative and it's allowed them to stay sober.
Like when someone's in crisis.
Yeah. I
Yeah.
just think it's a and I guess we're saying the same way, really the same thing in another way. It's like you can't, I guess the worry is that people can't expect to go do that and then just be sober. There's a lot of work. And so if you're not coming back into, I think, a very great system for you with, a system where you've already the substances aren't in your home. You've disconnected from the people that want to sell you drugs or alcohol, right? You've disconnected from the people you hang out that tend to do that with you. You have substitutive behaviors, you have your support system, you have your job or your meaning in life, it's volunteer. Then I think those things can sustain it. I think it would be a mistake that anybody could go from their life as it is, have a journey, and come back to their life as it is, and stay sober. So I think that's another way to evaluate it, right?
Yeah.
What are you going to return to after the experience?
And the environment is huge, right? Because oftentimes, I have this, idea or theory, this understanding that the outside is really a reflection of what's going on the inside. So if you have surrounded yourself with a bunch of people who are using it's they're doing it for the same reasons, like escapism, stress management, whatever. But that's just a reflection of your own values, like we're the average of the five people we hang out with type of thing. And so to come to this, take such a brave step and be like, I need to be sober, and you go to rehab. And so your environment is completely different. You're doing all kinds of self-reflection, you're processing like some deep grief and some really stress, like you're processing feelings to resolution, to then go back into that same environment is going to recreate the scenario that made you want to use in the first place. So it feels like changing your environment is really huge. I feel like community is a big part of that.
Community is a big part of it. As part of YBH, we have New Life House, which is young adult, male sober living's long-term residents, and we are so proud of our outcomes. We just did we have like for our 2023 and 24 graduates, we have like an 86% maintenance of sobriety for a year, which is really
Wow.
unheard of. But I think because we touch on a lot of those things. The guys come in and it's age specific housing. They're with men their same age, that the house managers have been through the process. They all get intensive outpatient therapy. Um, that the first 3 months, and then their stay in that community, right, as they find their jobs and move into apartments. There's a massive alumni programming that's very active that then keeps them right in that community, and then often, if indicated, a lot of them will do transcranial magnetic stimulation, which we sort of touched on before too, which is not FDA cleared for addiction. I think it will be
Right.
there soon, but FDA cleared for a very long time, and an amazing neuromodulatory technique which helps with mood, anxiety, but still he hits the circuitry, right, that we look at in addiction, right? That
Yeah.
the prefrontal cortex, which is, helps with control and impulse, and the dopamine reward pathway, and the medial frontal cortex, which has to do with emotional regulation. So it's I think when we can tackle an addiction from all these aspects, and not everybody needs everything, but most people need more than one thing, then we
They don't
really
hurt.
good outcomes. Yeah.
They don't hurt. Yeah. So it's so interesting. So I love this idea of the environment, the peer support plus therapy, I think is huge. And then the introduction, I think you know, for people who are, they decided to get sober, they maybe have like 100 days or more, like anything above like 100 days, you can start exploring different other modalities. And I think I initially, when your people reached out to me, she was talking about TMS, and I was like, wow, well, I haven't had a conversation about TMS for like we're 400 episodes in for probably 300 episodes. It's been a long time since we talked about TMS. So maybe you could sort of break it down for me. What does it stand for? What are the use cases? And what are the protocols? I think would be really interesting to kind of dive into.
Absolutely. So, TMS stands for transcranial magnetic stimulation. So, transcranial, right? Like through your cranium, through your skull.
No surgery required.
No surgery required, right? Outpatient procedure, and it uses magnetic stimulation to focally target, right, specific neurons that we know are not firing well in whatever we're trying to treat. So, depression, it could be addiction, anxiety, OCD. So, we have the capacity with the magnetic coil to we calibrate it individually to the person's head by placement as well as amount of energy, and that's sort of the dose, and we are focally targeting the circuit that we know is not functioning well, right, in that particular illness.
Can I
Yeah.
interrupt you real quick? So you mentioned neurons that are not firing well. Is the way it presents like like thought loops or patterns that keep looping? Like I often thought of like, people with addiction, it's like they have this core belief, and from that belief they have a feeling, and from that feeling they make a decision, and they take an action, and the action leads to a result, sort of cause and effect. And then it's either a confirmation bias, and then it sends them back into that loop again.
Mhm.
And these are these patterns that are super hard to break. And so it seems to me that there is a faulty presupposition, false belief somewhere. And so when you do the TMS, is it trying to break that circuit somehow?
I think that's a great clinical and human way, right, to describe it, right? Now,
Yeah.
obviously, we don't really know how any of these things truly work,
I
right? From
know. Yeah.
medications to psilocybin to ketamine to TMS.
Right. There's a lot of
We
mystery.
see right, but we know what we see in functional magnetic resonance imaging, right? So we can actually see the brain, we can see the parts of
Oh,
the neurons that are the ones that are functioning and not, how they're functioning relative to other parts of the brain and other circuits. And we do know, right, that certain
okay.
parts of the brain that are lit up, right, when somebody has depression or addiction or cravings more. And after TMS, when that illness like depression or the cravings are reduced, we see different brain patterns light up. So we do know that we are changing the communication between the neurons and how the circuits are functioning. So it's very cool to be able to see that.
Yeah, that would be cool to see it. So it's so cravings. It can help with cravings.
Yeah. So, back to your original
What?
question, right? So I think so it's an outpatient procedure, FDA
Okay.
cleared since 2008. The FDA cleared indications are many now. There's depression, there's OCD, there's migraine with aura, peripheral pain, actually, which isn't really transcranial stimulation, right? It's
What's peripheral pain? Is that like
like,
loss of limb?
yeah, like a sciatica pain from back pain,
Really?
diabetic, right, neuropathy. So when you have painful like feet or hands, from long-term diabetes, impinged nerves, right?
Mhm.
So it has an FDA cleared indication for that. What did I leave out? OCD, adolescent depression was recently FDA cleared last year for 15 to 21.
Mhm.
However, we there's tons of research in terms of efficacy for anxiety, even bipolar disorder,
Mhm.
obviously addiction, many studies. And when you think about it, it just makes sense, right? It's a matter
It
of
does.
figuring out where on the brain to treat and what pulse protocols. You reference protocols. In general, the depression protocol, somebody comes in every day, 5 days a week for about a half hour. There's a little scalp discomfort day one, maybe a little headache, but that's it. No other side effects. Works twice as well as antidepressants. People are noticing
Twice as
significant
well.
twice as well. Yeah. People are noticing significant improvements like within 10 days or 2 weeks, so 10 treatments versus, meds can take 4 to 6 weeks to
Yeah.
work. So it's pretty incredible.
I
And
have to ask you, I have to ask you about the sexual dysfunction because I hear from a lot of people that are on like Prozac or some other things that it affects your sexual or causes sexual dysfunction.
absolutely.
And so TMS, I would imagine, doesn't do that.
TMS is wonderful because of that. No sexual dysfunction, no decreased
That's important.
libido,
Yeah.
no weight gain, right? No
Oh, no,
cognitive
waking.
dulling or
Oh,
emotional numbing. I mean, talk about addiction and what causes some people to use, right, drugs and alcohol. It's to numb their feeling states, which are challenging. And then
yeah.
we put them on SSRIs, which are pretty much known to, not for everybody, but a major side effects people will say it's just numbing. I mean, it's like a wet washcloth over them. So sure, they're not
Wow.
depressed, but they're also not feeling
They
the
don't
joy
feel
of life
anything.
or the yeah. Um,
Yeah. Yeah. I hear that's a big complaint about people who aren't SSRIs. It's a sexual dysfunction. Like, yeah, you don't have those low lows, but then you don't, it dampens joy and all the positive experiences too.
yeah,
Yeah, I don't, right. So funny now that we have things like psychedelics. I mean, if the Michael Pollan, How to Change Your Mind, they're talking about people having these singular life-altering experiences, and then they don't need drugs anymore. I have a family member who actually was suffering from depression, had been on Prozac for years, and did a 3 series of the heroic dose psilocybin and completely got off medication. It's been 2 years, has not returned to medication. So you see these really amazing outcomes for people and it's just like, yeah, no more drugs.
yeah. I think it's gonna, it just takes time, right, to evolve a new treatment and medication in a safe. And I think people really are concerned about the accessibility,
Yeah,
even when if and when I think it's going to be a when FDA clearance comes. It's a pretty intensive long-term treatment. If you have licensed individual, those are many hours. So what's going to happen in terms of really access, right, and cost? But I,
yeah,
I do think it's exciting. I mean, you could look back into the 1950s, when the initial research was happening. There was already great evidence for things like psilocybin and
yeah,
LSD, really. And
yeah.
the reason it was shut down had less to do with the research and the chemicals, and it had to do with just the political
Political climate and
time.
more.
Yeah.
Yeah, sorry to derail you about the
Oh, no,
TMS,
no.
but
How exciting to talk about. It's a
I
great time to
know.
be in psychiatry and mental wellness, right? Because there are so many wonderful things coming out. The TMS and we always had the medications, but the psychedelics, there's VNS, like there's the microbiome and everything that's going on with the gut and the knowledge. I mean, it's
Yeah.
really exciting time to be in psychiatry and
It
psychology.
is, yeah. There's so many new things. And I feel like for those of us who are in long-term sobriety, things like TMS, listen, I would say, first of all, that it's not a drug
Right.
and it's not invasive. It's in alignment with 12 step. It's like therapy, so it's
Covered by insurance.
covered by insurance. That's amazing. Yeah, so it's not drugs or medication, so that's good. And I would think that that would be like the first line of defense. Um, yeah, because it's so easy to like think of, things like psilocybin or MDMA or ketamine as like a panacea, which they're not. Um, so people come in for half an hour a day daily for a period of time, and then what are the outcomes you've seen from that?
Yeah, so at YBH, we have about an 80% response rate, which means, it's hard. You can look at response and remission rates, which are a set scientific definition. So response rate is on a rating scale that you do, and it's greater than half reduction in the score. Remission is a set value. And so we have about a 54% remission rate,
Like in
which,
depression?
yeah, which is
Wow, that would
good for
be
you.
huge. That'd be huge relief for somebody who's struggling. I have
Yeah.
friends who struggle with depression, and it's so debilitating.
As well as the opportunity, not for everybody, right, to reduce polypharmacy if they're on multiple meds, some people to come off the meds. I mean, we do consider these more chronic illnesses, and it depends after, just like we were talking about sobriety, how much somebody does after to protect their sleep and their exercise and their stress levels and their sense of purpose in life and their relationships in terms of how long they'll go. But typical data for TMS is about 80% of people will still be in remission in a year.
That's amazing.
Yeah.
With no drugs and no sexual side effects.
Yes. Great quality of life, right?
Yeah.
Which is another thing I think we're looking at more in psychiatry and medicine now. We used to look at just treating symptoms and the decline of symptoms, and I think people that was also not the best approach, right? I think now we're really trying to shift and do a sea change and look at quality of life. Because we have
Yeah.
some people, especially with chronic, severe depression, who their rating scales might not will go down so much, but they'll say, "Oh my gosh, like I can get out of bed in the morning and go for a walk." And to them, that's a game changer in the quality of their life. So I think really trying to look at that, which brings in the comment that you're making about side effects, because sort of like if great, if my depression's treated and I don't enjoy sex and I can't experience emotions in the world, I'm not sure what my quality of life is.
I know. That's hard. Yeah, I feel like quality of life really is kind of the issue, right? Once we avert the crisis of addiction and being on this path of self-destruction, you learn to process, you identify what the core issue is, which I think is like 80% of the battle. Like you identify, oh, it was like my childhood trauma that was at the core of all this. And you begin to process those feelings to resolution with a professional. I think there's like a difference between peer support and professional support. Like peer support, those friends don't say, the hour is up. You know what I mean? Like,
Correct, correct.
and you can talk to them for free repeatedly, and so that's super important to have peer support. Um, but I think it's, equally as important to have professional support. What is the date? Because I see this is going to sound a little self-serving. I see people in the coaching space for addiction or so that have like 1 or 2 years sober. And they've like, oh my God, sobriety is amazing. It's like somebody newly sober wants to shout it from the rooftops. Everybody should do 12 step or everybody should be sober. It was life changing. Oh my God. Um, but then they want to charge money for it. And I see that as a problem because that is not enough time to have worked through your own issues. Because if you're working with somebody that triggers you, like you'll get triggered by the people that you work with if you haven't done your own work, and then that can cause harm. Is
Yes.
that a fair statement?
A very fair statement. And I think I think I was thinking about two things as you were talking. One, back to what I said about my own psychoanalysis and my
Mm,
psychoanalytic training and how I think that was invaluable for me because and I think most programs, right, if they don't, if you're becoming a therapist or whatever, if they haven't required you to do your own depth psychological, work, I think it's problematic. And even in the psychedelic space, it's listed as, to be a good guide, you really should have had your own experiences. And then there's the if as a clinician, if everybody came to me and I said, "Oh, you should do TMS," then that says a lot about me, right? That's not the
yeah.
way the world works, and so I think that's the other thing that you pointed to, right?
Mm,
Which is if they're 2 years sober and they did it through 12 step and it worked for them and they were all great. Same thing you hear it sometimes with a psychedelic, somebody who just did that and they're shouting that from the rooftops. They clearly don't, one thing doesn't work for everybody. We all
right.
need different things, and they're not, I think, experienced or educated enough to really sit with you as a professional and not that we, patient to me always knows best, but we know the options and we can educate someone and then they can listen to that and understand what's best for them, right? So I would say the same thing. I mean, not everybody who comes in is great for TMS or meds or needs sober living, right?
Right.
But if
Yeah.
you don't know the array of available, options, and you can't educate somebody on it, I think it's a disservice.
Yeah, or I think somebody, and I am a huge advocate of obviously of 12 steps and particularly giving back to the community. It's like once you've been through the steps, you sort of there's like this obligation to, they say that, to give it away, you have to give it away to keep it, basically. And I think the concept behind that is so interesting because as you are talking to somebody who's struggling with something and you share the information that you know will help them, you're actually reminded yourself of the very thing. It's like, oh, that's right, and it's like, wow, and oftentimes, like I, spent a long time, sponsoring other women. And so often I walked away, like it improves my self-esteem. It like reminds me that how far I've come. Like it has so much peer support is so beautiful in giving and receiving, right? It's a beautiful, but we got to stay in our lane because for the deeper traumatic childhood sexual abuse, domestic violence, traumatic events like war, car crashes, witnessing murders, like those need to be left to the professionals because they can be so objective and guiding you through that without them getting involved in your story or your process.
Yes, I think understanding the healthy boundaries, right?
Boundary.
And
Yes.
it's a training thing too, like a
Yeah.
learning that emotionally is really important. And like you said though, that's to me what's the great even teaching, like as you were talking, it's like, yeah, we always know whenever we go as somebody and then we're like teaching somebody else something we've learned, you get such a sense of, wow, I really learned a lot, right?
Yeah.
Wow, I know that. It helps my self-esteem. And I think that's the same
Yeah.
thing you're talking about in just terms of a life experience and recovery, that people have most wonderful things to share. Oh, we all the people that we use, right, for our sober livings and in our dual diagnoses have all come from the recovery space. And
Yeah.
I think it's crucially important because there's just something that you guys bring that I can't bring.
Yeah.
Just your own experience, and it comes across so it comes across quickly, and
Yeah.
outcomes are so much better.
Yeah. Yeah. Yeah, I feel like working in partnership, I feel like both are necessary. I don't see any reason not to do 12 step, and I don't see any reason not to do, seek professional help if you can.
Correct.
Yeah, both are really important. Wow, I feel like we covered a lot of ground in this conversation. I just so appreciate your time. And you've mentioned your behavioral health as the organization that you're affiliated with. If people are interested, I feel like this probably has brought up a lot of questions for people if they're curious to learn more about the work you do and your organization. Where can they find you?
Perfect. They can just go to yourbehavioralhealth.com, or we have that's the parent agency. We've been in the community for 40 years from the New Life House
Wow,
perspective.
40
And
years.
I know 2015 for Clear Behavioral Health and 2017 for Neuro Wellness Spa. So those are the three branches of the company. But
Okay.
the whole concept of it was really creating um, access, insurance-based access to really high quality care and innovative care. And so we go from everywhere from outpatient individual therapy, medication management, TMS, up to we have intensive outpatient, partial
Mhm.
hospitalizations, detox residentials, separate residentials for um, addiction and mental health disorders. And we do adolescents also. So we really try to have the whole gamut and meet people where they're at and let them be in the system that's going to best serve them. So
I love that, meeting people where they're at. And like you said, I feel like you said earlier that, the patient knows best. And I really feel like people need to, it's a funny, isn't it kind of a funny paradox? It's like we ultimately need to trust ourselves, but when you're in this crisis period, we need to trust others
right.
until we can trust ourselves again. But like even in the crisis, people know what's right for them.
Yes.
They may be confused and they may be in crisis, but like ultimately we have to, it's like a gut check level. It's like,
Agree. A
yeah,
nice guide, maybe back to that term, is what something really needs. Maybe someone who's a little bit more grounded in that crisis to orient them and organize them. And
yeah,
I think at the end of the day, though, respecting always, right, the other's autonomy and choices is incredibly important. It just won't work. I mean, I'll tell you that from years of
right.
I've been in this field 30 years and it doesn't. I tell a funny story sometimes, which is funny. So I was doing TMS and I hadn't been doing it that long. So I think it was maybe 2010. And this gentleman drives down to me. He's 86 years old and he wants to do TMS and he hasn't been on a medication. And I said, well, that's great. I'm like, you should at least try like one antidepressant, right? It's just easier, privacy of your own home. You're not driving every day. And he's like, no, 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 I want to do it. Come on, you should just try. So I stick him on this small dose of Lexapro. And literally 3 days later, he calls me from the emergency room and he had urinary retention. He couldn't pee, which is a known thing with the
Oh,
SSRIs.
wow. Oh,
And I
yeah.
was like, well, right? I should have just
Yeah.
listened to him.
I
And
should
he
have
did
listened.
TMS and he did wonderful. Right. But sometimes it's even hard as a professional because you're looking at
Yeah.
cost and time and effort. But I
Yeah.
always remember that. And yeah, usually you guys, yeah. When we're on the patient side, we know that
Yeah. So did he come for the TMS then?
he did. He came for the TMS. He had an amazing outcome at the time. He
Okay.
had been the eldest person that I treated. It was fabulous.
Bless his heart. 86 years old and he's still wanting to get better.
No,
I
it was
love that. That's
yeah.
inspiring. Yeah. I'm on the
Right?
back nine of 50. At 56, it's like, yeah, but it's just so interesting how no, it doesn't matter how old you are, your life circumstances will always be changing, and then we need to adapt to that level, and then they change, and then we need to adapt to that level. So there's always a constant need for evolving, for seeking support at any age. But 86, that's really cool that he did that. A man, no less.
Oh, I love it. And I think if we're stagnant, there's a problem there, right? Like there's
Seriously.
constant change and constant opportunity, right? I mean, that's just the space
Yeah.
I come from. I love learning about myself and even when, challenging bad things happen, it's frustrating and it's hard,
Yeah.
right? But it's such a great opportunity to think about,
Yeah.
well, why did I have that reaction and how could I have handled it differently and
Yeah.
what will I do next time? I think there's just a wonderful opportunity in those moments.
Yeah, it's a gift. The gift that keeps on giving. Life
Yes.
is. Well, listen, Dr. Good, thank you so much for your time today. Such a joy to talk to you, and best of luck on your endeavors. And I'll leave all the links in the show notes.
Thank you so much. Have a beautiful rest of the day.
You too.